So here we're going to be doing a modified RDL where we're using a wall or a door to give you some feedback as to how to move. This can also be considered a hip hinge movement. So again, all you need is a wall or a door. Make sure that the door is latched because you will be touching that with your body weight. And so if it is open, we don't want it swinging open and you tumbling down. Okay. So what you're going to do, you're going to sit your body or situate your body so that your back is to whichever you're using. So whether it's a door or a wall. And you can start out closer to the wall, and then the goal would be to move yourself forward so that it's more and more challenging as this gets easier. Now, at some point, because mechanics of how our bodies move and how long your limbs are, if you get so far away from the door, you're no longer going to be able to touch the door no matter how hard you try. And that's okay because this is just designed to help you learn the body movements and the mechanics of how that movement is supposed to happen in your body. So it's not meant to be something that you stick with all the time. Okay. What you're going to do is you're going to situate yourself. Make sure your feet are nice and even with each other because we don't want to be stagger stance for this yet. Okay, so feet are even. And you're going to make sure you kind of check to see the distance here just in case so that you know exactly how far back it is. And then what you're going to do is you're going to start with a slight bend in your knee. Now, after this, your knees no longer are bending on their own. So we're not doing any sort of squatting motion. Okay, so my knees are not active in this, but they will passively move just because my hip is moving, and therefore my knees will have to move as a result of that hip movement. Okay, so slight bend in the knees, and then what you're going to do is you're going to stick your butt out like you're trying to touch that door or the wall with your butt. Okay, and as soon as you feel that butt touch, you're going to stand back up. Now when you stand up, I want you to think of pushing your hips forward because to initiate the movement we're pushing our hips back. I don't want you to think from here standing up because then you're going to arch through your back too much, and we want to make sure that the movement's coming from your hips. So you're going to sit back, touch the wall, and come back up. If that's really easy for you, then you're going to step a little bit forward and try again. Now there's a little more distance, okay? But same rules apply. You're going to sit back with your butt, touch that wall, and come back up. Make sure that you're thinking pushing your hips forward and not standing up too high because we don't want your back doing the work. Now, as you notice, if my hips go backwards and I'm keeping my back in a neutral position, not rounded, not arched, my chest ends up kind of coming down like it's going to face the floor. That's fine and normal. We want that to happen in this scenario. If you try to keep your chest really tall and sit backwards, you're going to end up falling over because at some point your hips can't move without your back going with it. Okay? So, keeping in mind that your chest is going to end up pointing down towards the ground, and that's okay. All right? Now, again, at some point, as you move forward, eventually you're going to get so far away that it's going to be nearly impossible to touch that door. And that's all right. Again, remember, this is just for form. Now, if let's say you start and you're a little too far away and you end up falling into the wall, and then to get off, you're like having trouble, and so you need to use your hands. That's fine. That just means that you're too far away and you need to back up and then go from there. Okay? If you want to start closer to make it easier, that's fine, and then work your way out. We're just working on form here so that we can work on other lifting techniques later.